There it is. All right, here we have the catheter and then the vein. We pre-measured it. This is the vein size and catheter. Here's what I mean when I talk about catheter to vein ratio size. Let's see here. Catheter to vein ratios. This is going to be 12 over 22, which equals about 0.545. I'm going to round that up to 0.55, which equals 55%. So this is definitely more than our desired 45% catheter to vein ratio, which is probably why we're seeing some thrombosis here. Okay, there's definitely a thrombotic event, and what's interesting is if you look carefully, you'll also see a leaflet here. I believe this is a valve. There's a bit of a bulge, as you can see here, a little bit of a bulge here, which indicates to me that it is a possible valve, and the medication that was flowing, or the reduction in blood flow, also known as hemostasis, was potentiated, and the hemostasis increased with the turbulence from where the valves are located. There's a theory out there that possibly having the catheter tip too close to the valve will cause more thrombosis events inside the veins. Theory, but kind of makes sense. What we want to do is be careful about how we draw the blood here, because remember, one of the reasons why we're hemolyzing blood is due to inappropriate amounts of pressure, positive or negative. I believe it's more negative that causes hemolysis rather than positive. Don't quote me on that, I have to double check. But inappropriate amount of negative pressure could and will hemolyze the blood. So when we're pulling the blood from the venous return, and of course there's not much return at the bottom here because it's pretty much completely obstructed by the catheter. But whatever little flow that we can take advantage of from the top area here, we're gonna draw that blood and it's gonna try to get sucked into these narrow spots. Now, I understand that the catheter lumen looks pretty small, but keep in mind, these red blood cells are significantly smaller. So it's not like they're trying to squeeze into, like each cell is trying to squeeze into the lumen of, or the opening of the catheter. It's a whole bunch of them. Okay, it's a whole cluster of these red blood cells trying to get into the catheter, and the increased pressure causes the whole crowd, the hundreds, if not thousands of cells that are trying to get into this catheter at the same time. So we have to, in a orderly fashion, don't run, walk during an emergency type of pressure. And so we need to draw the blood very carefully, very slowly, and very gently with the least amount of pressure. The problem with these vacutainers that we draw blood with, they have a fixed negative pressure. You can't control it. And a lot of times with these inappropriate catheter to vein ratios, that negative pressure from the vacutainers could be overwhelming or too much, causing a lot of turbulence and a lot of red blood cells trying to pack into each other into that one small opening. So the recommendation is to use equipment that allows you to draw with the least amount of pressure. And that means using a smaller diameter syringe where the human can control the negative pressure is desired, or is going to bring about a desired outcome. Meaning, the skinnier your syringes versus your 10 cc fat syringes, the skinnier syringes are going to allow you for more granular, less amount of pressure than the 10 cc syringes. The smaller the diameter, the more control you can have over that negative pressure. So when you're drawing with a smaller 3 cc syringe, you're going to be able to draw with even less pressure and more gently, and we're going to show you how to do that.